published a series of 3 papers recently which look at quantifying the excess health burden and risk that people who use biomass fuels face as compared to those who use the cleaner alternative, which is LPG. Now, globally there is about 3 billion people who currently depend on traditional solid fuels for the use of cooking. In India, the percentage of population is more than about 43%. There are many states in India in which there are more than 50% of people who depend upon traditional solid fuels for cooking. Now, cooking with these fuels in indoor kitchens, which are small and non-ventilated spaces, leads to a lot of exposure to aerosols and toxic chemicals. We wanted to quantify this exposure to aerosols and various chemicals associated with it. For example, trace metals, which are mutagenic and carcinogenic, and also certain organic species, organic molecules, which are also mutagenic and carcinogenic. So for this purpose, what we did is that we devised a field campaign in rural villages of northeastern India, in 3 states of northeastern India, for example, Assam, Himachal, Pradesh and Meghalaya. And we measured aerosol concentrations and exposure in these indoor kitchens, followed by characterization of the chemical speciation of these aerosols, and then coupled that with a deposition modeling or a dosimetry modeling in order to estimate how much of these aerosols and chemicals are deposited in our respiratory tract. What we found is that the levels of aerosol exposure and the levels of exposure to these chemicals are at least 2 to 10 times higher in biomass using kitchens than they are in kitchens that use LPG. If we look at the amount of the dose of carcinogenic chemicals, the dose is higher by a factor of 8 to 40 in biomass using kitchens. We found that only about 30 to 79% of the chemicals that are present in the aerosols are actually deposited in our respiratory tract, and then they can be deposited in 3 sections of the respiratory tract: the head section, the tracheobronchial section, and the pulmonary section. Using these deposition estimates, we then used a metric called the potential years of life lost, which measures the number of years that a person loses if he or she dies prematurely due to an illness. We did this with respect to respiratory disorders, for example, COPD, lung cancer, upper respiratory tract cancer, and pneumonia. And we found that the rates of potential years of life lost and the disease burden were higher by factors of 2 to 57 in biomass using kitchens as compared to those used LPG. Finally, we also looked at the potential for causing oxidative stress, which leads to damage in the cells due to the inhalation of these particles that come from biomass burning. And we found that the levels of oxidative stress that could be imparted on the individuals are at least a factor of 5 higher as compared to those who use LPG as the clean fuel.
In our recently published 3 research articles, we have observed that these chemical parameters such as aerosol mass and the associated trace metals and organics, and the other effect that we have quantified in our research studies such as respiratory deposition, disease burden and the oxidative stress. All these parameters show a significant higher concentrations or higher risks in the kitchens that are using biomass. For the first time, we have quantified these risks with respect to the LPG using kitchens, and also based on this research or based on these findings, we suggest certain possible solutions that can be used or can be targeted to provide a better solution to the kitchens using biomass. First is transition from the kitchens that are using biomass to clean fuels. Second is that we suggest that the kitchens that are using traditional stoves, the transition to the clean or improved cook stoves. Third, we suggest that we provide a localized solution so that in every or certain regions of the country, the solutions are provided based on the necessity of the public of that region. And fourth, we suggest that there is a need of a national level survey in terms of health survey, in which it will give us an understanding regarding the severity of this usage of biomass and how it is impacting the human health in the rural sectors of the country.